Hi, I'm Dr. Kriti Lohia, consultant dermatologist, CEO and medical director at Aesthetics Redefined by Cocoona. And today we have Dr. Sanjay Parashar, consultant plastic surgeon and co-founder of Aesthetics Redefined. Thank you so much, Dr. Sanjay, for joining us back in this FAQ section. And today I would like to ask you questions about facelift. So first of all, why is it that most people who want to get facelifts done from India never actually end up getting it done from India and they track you down in Dubai to do it?
Yeah, because facelift is not a very common procedure in India. Okay.
Right.
One good thing is we have good skin. We don't age very fast,
Yes.
But because of the lifestyle, because of the changing patterns and lifestyle of people where, indulging into food habits or smoking habits or a lot of other things with a lot of weight fluctuation, there are a lot of changes occurring in the face now.
True.
So I have started seeing more and more Indian patients, particularly women of course, and also men asking
Right.
for lift.
Right. Sir, when is it a good time for someone to get facelift done? Because a lot of people post the age of 50 or 60 quite essentially would be obvious choices for facelift. But I also get patients as young as 40 who seem like they have about moderate amount of sagging, face thoda sa aise hone lag gaya hai. Would they also be a good candidate? How do you identify a good candidate for facelift?
अब मैं जो बोलूँगा ना उससे डर्मेटोलॉजिस्ट मुझसे नफरत करेंगे but let me tell you. So what happens in the past, facelift for people who are really old. When they are in their 60s, late 60s, when they have a lot of extra sagging skin, that is when they would consider a facelift. But in modern generation, everybody wants to look great. They all want to look glamorous. They want to be picture friendly all the time. And women, of course. So
Right.
they want a solution which can give them a lift. They want instant result.
Right.
They want something that will last longer. They don't want to keep coming back for Botox or for filler. Some people don't like the look of filler when they have filler injected,
Yeah.
So there is a lot of these things have started happening. Before, people were being treated by fillers and Botox to just delay aging.
Right.
But now people are going away from filler to some extent.
That is true. That is
So
true.
actually facelift can be done in a younger age, and there is a new technique for that. Okay.
What?
One of the technique which has become very popular in the West actually, and we have adopted that, is called ponytail lift. So ponytail lift means you can do a hair facelift from within the hairline, and it is almost like making a ponytail and getting that lifted and youthful look. With that foxy face appearance, and that has become very popular and it's in trend.
Wow.
So that can be surgically done by a scar which is hidden in the hairline.
Then nobody would know.
Exactly. And of course, I being intelligent person, I have innovated that for our Indian skin. In European countries, they use lot of external stitches, because there is a big risk of bleeding in those people for whatever reason. So, but what happens is the result of that is for about few weeks they cannot go out, they cannot see people, they cannot meet people because there's a lot of bruising, swelling,
Right.
a lot of stitch marks there,
Right.
So I have modified for our Indian skin because
Right.
they don't want to be seen grotesque or horrible.
Very
So
true.
I do certain internal technique stitches. It's called internal hemostatic net that actually gives them a lifted and a youthful look the next day itself
Oh my God.
with minimal swelling and hardly any bruising. So that has actually been a game changer.
Wow. One of the biggest questions that I do get asked from patients is that agar if I'm thinking about facelift today, what is the downtime? Can I go outside tomorrow or not? Or what all different things will I have to do? How long will I be out of commission for? Because a lot of these people are in jobs where they have to be people facing in front of the camera. So quite essentially.
So, yeah, you're right. So what we do is if you follow these techniques that I have mentioned there, in about 3 or 4 days time, if they put minimal makeup, they can go out and nobody will know that this person had a facelift. Okay. Maybe a close friend or family might still see some swelling and differences, but within 1 week, if they put makeup, they attend a wedding party, nobody would know that they have facelift.
So I think you predicted that I might hate you for this, but I'm loving you for this piece of information, because what better way to help people, because face is quite essentially the first thing you see. And you're right, weight fluctuations, especially for women, especially in Indian population, it makes them so conscious about how they look. They need something like this. So facelift is no longer for only 60-year-olds.
Not necessarily. So what we do is we, of course, identify what is the problem, see how much it is bothering them, you know.
Right.
And obviously, first attempt is always to try and treat it with simple things. Sometimes, you know, smart use of filler will work, or maybe little Botox will work. Maybe occasionally threads may work.
That is my favorite.
But but if I feel that that's going to cost them a lot and would be a recurring cost, it may not be cost-effective treatment for them.
That is true.
Then I believe that facelift might be a more cost-effective option for them. So obviously there is a lot of evaluation that we have to do, and based on a person's medical health and their structure, we plan these procedures.
But do you combine facelift with a neck lift always?
You can also do that with an hidden, without a visible scar, where all the scars are hidden inside the hairline. That's the secret, which I can share you at some other point. But yes, that's possible.
All right, that was absolutely lovely, Dr. Sanjay. Stay tuned to know more about the secret technique about a neck lift that we can combine with facelift in our next session.